Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to co-found SPT with Me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our courses at sptwithme.com. Now for what you're actually here for, let's talk about stroke, made simple. We've all heard of a stroke, and we know that there are two types, hemorrhagic stroke and ischemic stroke. The purpose of this video is to really gain a true understanding of what a stroke is. And I'm not talking about what to expect if there's an infarction at, like the left MCA and what you can expect to see out of that. What I'm talking about is really putting together conceptually what a stroke is. That way you can really understand it. So the first thing I want you to consider is what the body is made of. As a physical therapist, the first thing that you probably think about is the musculoskeletal system. And of course, yeah, we have that. But in the case of talking about strokes, I need you to think about the circulatory system. Of course, every system communicates with each other, but for at least the time being, just focus on this system. Now, when you first think about this system, you probably think about another muscle, which is the heart. And yes, okay, that's fine. But what I actually want you to think about is the blood that runs throughout our body. Our blood is so incredibly important. There's a lot that's stored and transported in our blood. The first thing that should come into your mind is oxygen. Our bodies literally cannot survive without oxygen. If I have a lack of oxygen to my toes, all of the tissues that I have in that region are going to die. If I have a lack of oxygen to my fingers, all the tissues that lack oxygen are going to die. If I have a lack of oxygen to my heart muscle, the tissue that's lacking oxygen is going to die. Do you see where I'm going with this? If I lack oxygen to the brain, the tissue that doesn't get the oxygen is going to die. This is literally what happens with a stroke. I know we categorize strokes into hemorrhagic and ischemic, but honestly, regardless of the mechanism, a stroke occurs purely due to lack of oxygen to a section of the brain. Of course, categorizing which mechanism has happened causing the stroke, it's crucial to treating it and learning what to do to prevent another one from occurring. But going back to the previous discussion point, a lack of oxygen to the brain is why a stroke happens. As we know, there is an extensive network of arteries that go throughout the brain to supply particular regions, thus supplying the oxygen that we need to allow certain functions to occur. Some really smart people over the years have been able to map out which arteries supply which regions of the brain. So think ACA, MCA, etc. And it's a good thing that we have so many different branches, because if one of them gets damaged, we have others that work. If we just had one that supplied the entirety of the brain and this one got blocked or torn up, the entire brain is going to be toast. Now, despite our body's best efforts, things happen and we can have unfortunate incidences of a blockage at certain arteries within the brain, a blockage or tear. Once again, regardless of which mechanism it is, this results in a lack of oxygen to the site that this artery normally supplies. What happens is that normally, every single second that goes by, there is oxygen being distributed to tissues to help it continue working and thriving in its job. But as soon as you disrupt that oxygen diffusion, even for a millisecond, half a second, whatever it is, this is going to cause damage to that tissue. Oxygen is everything. Every single second that the brain tissue is deprived of oxygen, even if it gets 60% or 80% of what it normally gets, anything that's not the full potential of what it could get is going to result in damage to the tissue. Thus, function will be affected. Every second that goes by, more cells are going to die. Time is brain. That's what a lot of neurophysical therapists say. Tissue damage is really going to be directly proportional with the length of time that the oxygen has been limited in or deprived of. So to have a summary of what I'm trying to say, a stroke in general is tissue damage of brain material due to a lack of oxygen because blood flow has been disrupted. The oxygen in the blood cannot make its way to supply the brain tissue that it normally does. Oxygen is crucial for all of us, not only for survival, but in our ability to thrive for all these particular functions of all these body regions. Of course, in this video, we've been talking a lot about the brain. Obviously, we're talking about strokes. but understand that you can apply this logic to anywhere in the body. A lack of oxygen anywhere is going to have the same or at least a similar effect in that the tissues that the blood is normally supposed to go to, so oxygen that's normally supposed to be supplied to the area, if its transportation is disrupted in any way, the function of that tissue will be impaired. So think about a pulmonary embolism. So think about the arteries that are going to the lungs. Think about a heart attack. So the arteries that are going to the heart muscle itself. Anywhere, it's all the same idea. All it is that it's affecting different regions of the body. If you thrive on information being explained in this way, check out our prep courses at sptwithme.com. This is what we're all about, changing the way that you think to study for the NPTE. Check out these references for more information.